First question says a 26-year-old man, he comes to the office due to myalgia, nasal congestion, and cough. Okay, temperature is pretty high, 100.9 Fahrenheit, 38.3 degrees Celsius. Examination shows nasal and pharyngeal hyperemia. So, rapid influenza antigen testing of nasopharyngeal secretions is positive. Then the infected cells of the patient's respiratory tract. Viral proteins are viral proteins. So here there is hyperemia. Hyperemia is excess of blood there because of congestion or obstruction. So rapid influenza test was done and it is positive. The test was through nasopharynx. Okay. Within the infected cells of a patient's respiratory tract, viral proteins are degraded attached to major histocompatibility complex MHC class 1 molecules and MHC 1 molecules. Okay, MHC 1 molecules, and which are expressed on the cell surface while proteins are degraded and attached to major histocompatibility complex 1, which are expressed on the cell surface for presentation to cytotoxic CD8 plus lymphocytes. Okay, which of the following is the most essential to initiate the immune process, whether it is acid phosphatase, caspase, guanylate cyclase, myeloperoxidase, and ubiquitin ligase? I think this question is easy, everybody will answer. The answer is ubiquitin ligase. So let's see ubiquitin ligase. So this is the ubiquitin dependent protein catabolism. This is the target protein, and the ubiquitin, the presence of ATP, proteasome is formed. Proteasome, then it takes ATP and it will form this ubiquitin cleaved. So this is the ubiquitin cleaved from target protein and recycled hydrolyzed oligopeptides. If you see this topic, the cellular immune response. The cellular immune response to a viral pathogen, example influenza, requires the presentation of viral antigens to effector immune cells, example CD8 positive lymphocytes. So the cellular immune response to a viral pathogen. So there is a cellular immune response to viral pathogen requires the presentation of viral antigen to effector cells, that is CD8 positive lymphocytes. As you know, the ubiquitin proteasome pathway UPP is essential to this process because of this role in breaking down native and foreign intracellular proteins. Ubiquitin ligase initiates the UPP by recognizing specific protein substrates and catalyzing the attachment of ubiquitin. The protein tagged with ubiquitin are then broken down by a proteasome to a peptide fragment which can be recycled into amino acids. So here, the cellular immune response to viral pathogen requires the presentation of viral antigen to the So the cellular immune response to viral pathogen influenza requires presentation of viral antigen to CD8 positive lymphocytes. So this ubiquitin proteasome pathway is essential to this process because of its role in breaking down. So UPP has a role in breaking down native and foreign intracellular proteins. So ubiquitin ligase is the enzyme. It initiates the UPP, that is proteasome pathway. UPP by recognizing specific protein substrates and it recognizes ligase. It recognizes the protein substrates and catalyzing the attachment of ubiquitin and catalyze the attachment of ubiquitin. The protein tagged with ubiquitin are then broken down by proteasome to peptide fragments which can be recycled into amino acids. So what happens in UPP as I have seen here? So this is the UPP catabolism mechanism. So this is the target protein which has to be broken down. It can be native or it can be foreign. And this is the ubiquitin. So ubiquitin ligase, it recognizes the target protein and it uh, helps in the attachment of ubiquitin. Okay, after the attachment of ubiquitin, this proteasome, it it causes the lysis of these tagged proteins and the ubiquitin. Okay, so this way it causes catalyze breakdown. Okay, tagged with ubiquitin are broken down by a proteasome to peptide fragments. These peptide fragments are into amino acids and this can be utilized. The peptide fragments produced during this process can also be coupled to major histocompatibility complex in the endoplasmic reticulum and then presented on the cell surface. So these peptide fragments, whatever has been broken down, it is going to be the peptide fragments produced during this process can also be coupled. These amino acids can be recycled and it can also be coupled to major histocompatibility complex molecule in ER and then presented on the cell surface. So this can be coupled to MHC class 1, in the endoplasmic reticulum, and then presented on the cell surface. So cytotoxic CD8 lymphocytes recognize non-native viral protein on infected cells and trigger apoptosis of the cell by activating the caspase cascade through the release of perforin and granase. Okay, perforin and granase. So this is the mechanism. Understood? So here the apoptosis after after it reaches it is recognized by the CD8 positive lymphocytes, then the proteins on the infected cells are recognized and then the trigger is there for the apoptosis of the cell by activating the caspase cascade through the release of perforin and granase. Choice A is acid phosphatase is found in the lysosome. So there is acid phosphatase and it is found in the lysosome. So acid phosphatase, it is found in the lysosome of mast cells. So my mast cells have lysosome. In that acid phosphatase are found. So acid is found in lysosome of most cells and hydrolyzes organic phosphates, but it is not involved in antigen presentation. So, um, acid phosphatase is found in the lysosome of most of the cells and hydrolyze organic phosphatases, but it is not involved in antigen presentation. So, acid phosphatases, they are not involved in acid phos and antigen presentation. Okay, these are not involved in antigen presentation, and they are present in the lysosome and they hydrolyze organic phosphates. Talking about guanylate cyclase, it is involved in the G protein signaling cascade and it plays a crucial role in the activation and regulation of diverse physiological processes, smooth muscle relaxation, and retinal retinal phototransduction. Guanylate cyclase, G cyclase, okay, G protein signaling cascade plays a crucial role in the activation and regulation. Talking about myeloperoxidase, is the key component of the respiratory burst of neutrophils released into the phagocytic vacuole and extracellular space as part of immune response of bacteria and other pathogens. Talking about educational objective, an essential step in the active cellular immune response to virus is breakdown of intracellular viral proteins by the ubiquitin protease pathway is initiated by ubiquitin ligase which recognize specific protein substrate and attach a ubiquitin tag. The target protein are then degraded by a proteasome into peptide fragments which are coupled with MHC class 1 and proteins. Class 1 proteins are presented on the surface for surveillance by cytotoxic CD8 plus lymphocytes. So ubiquitin is the very important thing. Remember this pathway, and malaperoxidase is a key component of the respiratory burst of neutrophils, as you already know. Is respiratory burst of neutrophils and is released into the phagocytic vacuolar extracellular space as part of immune response to bacteria and the pathogen. So this is MSC class 1 pathway, and if you see, this is endoplasmic. This is the endoplasmic reticulum. This you are seeing endoplasmic reticulum, okay, and this one is the MHC class 1, which is to compatibility complex, and beta 2 microglobulin is there here. So what is happening? This is intracellular pathogen, and this is proteasome, and then peptide fragments are produced of this pathogen. Then this is presented on the MSC class 1, and this is the TAP proteins through which it is entering. Okay, and TAP is nothing but transporter associated with antigen processing. And then here there is expression of the protein, and this is expressed to CD8 plus T cell. And CD8 plus T cell is activated, and further process takes place. The correct answer is ubiquitin ligase. So what you have learned from this question is ubiquitin protease, ubiquitin dependent pro- pathway, ubiquitin proteasome pathway. Proteasome is the actual thing which cleaves, and ubiquitin ligase identifies that protein which has to be cleaved. Okay, and it uses ubiquitin as the for attachment, and as a and then the proteasome proteasome cleaves it. Okay, now let's talk about next thing. Next question: a 24-year-old male is evaluated for recurrent episodes of abdominal pain and bloody diarrhea. So there is abdominal pain and bloody diarrhea. The patient has also low grade fever and fatigue. Physical examination revealed left lower quadrant tenderness, left side lower quadrant tenderness. CT scan of the abdomen showed thickening of distal colon and rectum. During one of the laboratory tests, the patient's anticoagulated blood is placed in an upright thin glass tube and left undisturbed. One of the laboratory tests, the patient's anticoagulated blood is placed in a right upward thin glass tube and left undisturbed. His red blood cells form a stack and settle to bottom at a fast rate of 50 mm per hour. Same, which of the following substance most closely associated with these observed findings? So this is bradykinin, erythropoietin, interleukin 6, leukotriene, platelet activating factor, thrombo A2. So serum levels of which of the following is most closest with this observed findings? His blood cells form a stack and settle to the bottom at a fast rate. So this is something related to what? Interleukin 6. Let's see. This patient who has recurrent abdominal pain and bloody diarrhea with CT scan evidence of bowel wall thickening in a distal colon rectum likely of ulcerative colitis. Ulcerative colitis involving rectum and the colon. Distal colon and the rectum. Rectum involvement is must in the colitis. Ulcerative colitis. Chronic inflammatory condition characterized by persistent stimulation of neutrophils and macrophages linked to long-term elevation of circulating pro-inflammatory cytokines such as interleukin 1, 6, tumor necrosis factor alpha, and interferon gamma. I don't know why I'm so sleepy today. I already slept for some time, but still. Anyways, so ulcerative colitis, there is a bowel thickening, especially of rectum and colon, distal colon, especially rectum. So chronic inflammatory conditions characterized by persistent stimulation of neutrophils and macrophages leading to long-term elevation of circulating pro-inflammatory factors like cytokines like IL-1 and IL-6. So there is long-term elevation of circulating pro-inflammatory cytokines. So today actually I also have one outside food and now I'm feeling like there will be some bowel disturbances. Anyways, let's wait and watch. So the chronic in here in this case, because in ulcerative colitis it is a chronic inflammatory condition, and there is continuous stimulation of neutrophils and macrophages linked to long-term circulating pro-inflammatory cytokines like 1,6 and 1 and 6, IL-1 and 6, and tumor necrosis factor alpha and interferon gamma. The liver responds to these circulating cytokines, particularly IL-6, by generating acute phase reactants, proteins that modulate the influence of the inflammatory response and play some role in innate immunity. So I went to get my pencil. 1 second, can you give me one? So here you can see that in this case there is increase IL-1 and IL-6. Let's choose some vibrant color so that we can stay concentrated. Okay, so there is IL-1, IL-6, and tumor necrosis factor alpha, and interferon gamma. So these are the pro-inflammatory cytokines such as IL-1 and IL-6. So these one, and along with the tumor necrosis factor TNF alpha and interferon gamma, this already you know, but whoever has forgotten, reverse. The liver responds to the circulating cytokines, particularly IL-6, by generating acute phase reactants, proteins that modulate the influence of inflammatory response and play some role in innate immunity. So, liver responds to this, that you're producing so many inflammatory factors, that is IL-6, and now the liver will respond producing acute phase reactant proteins. These proteins modulate and influence the inflammatory response and play some role in the innate immunity. Testing for acute phase reactants can help diagnose and track conditions associated with inflammation, including infections, autoimmune disease, and malignancies. So, you have to test these acute phase reactants. The test described in this case is the erythrocyte sedimentation rate, ESR, already understood from the question by that they are giving the stacks and all, which begins by placing whole blood in a narrow vertical tube. Erythrocytes settle at the bottom of the tube over time due to gravity, and its density is greater than plasma. ESR is a measure of the length of the plasma on top of the erythrocyte sediment layer at 1 hour. At 1 hour, how much is the length of the plasma at the top of the erythrocyte sediment layer? The presence of acute phase reactants, particularly fibrinogen and globulins, cause erythrocyte to overcome the zeta potential, that is negative charge that separates them and form a stack. So you know all the cells they have negative charge, erythrocytes they have the negative charge. So they overcome the zeta potential because of acute phase reactants, that is fibrinogen and globulins. So they form a Rolex which settle to the bottom of the tube more quickly and they increase the ESR. This is mostly looking like a physiology question. So first option they give bradykinin. So bradykinin is a component of the kinin system and it is short-lived peptide and it causes vasodilation, increase vascular permeability and stimulates endothelial smooth muscle dilation and mediates pain. Option B was given erythropoietin. It is a growth factor for erythrocyte precursor in bone marrow used by peritubular cells of kidney in response to hypoxia. There is peritubular cells. Okay. Lichitrin B4 is a metabolite of arachidonic acid. Its main function is to stimulate neutrophil migration to the site of inflammation. Leukotriene B4 stimulate the neutrophil to migration to the site of inflammation. Platelet activating factor is released by endothelium. I'm having severe pain. Okay. Platelet activating factor is released by endothelium. So there is endothelium and platelet activating factor is released by endothelium, as you already know, and platelets and immune cells, and it's involved in leukocyte function. Example: endothelium attachment, phagocytosis degranulation, special endothelium attachment, platelet stimulation, and changes the vascular tone and permeability. Option F was given. Thromboxane A2 is one of the products of cyclooxygenase pathway. It is synthesized by platelets, influence the inflammatory response, and plays some role in innate immunity. Influence. Testing of acute phase reactants can help diagnose. So I think there are so many options in this question. We have discussed bradykinin cannot be, erythropoietin never, B4, leukotriene B4, no. The platelet activating factor and thromboxane A2. So nothing. The answer is interleukin R6, which causes acute phase reactants. Okay. Testing for acute phase reactant can help diagnose and track conditions associated with inflammation, including infections, autoimmune disease, malignancies. This same thing is repeated. So bradykinin, it is the kinin system. Short-lived peptide, it causes vasodilation, muscular permeability is increased, endothelial muscle stimulation, matlab dilation, and mediates pain. Erythropoietin, it's a growth factor for erythrocyte precursors in bone marrow. Peritubular cells prepare them. Who? Peritubular cells. Remember this. Leukotriene B. Leukotriene B is a metabolite of arachidonic acid, main function to stimulate neutrophil migration to the site of inflammation. Understood? To the site of inflammation, they stimulate neutrophil to come to the site of inflammation. Platelet activating factor endothelium is released by endothelium platelets immune cells. It is involved in what? Leukocyte function, platelet stimulation and changes vascular tone and permeability. That is endothelial attachment, phagocytosis and degranulation. Thromboxane A2 products of the cyclooxygenase pathway. Remember this, and is synthesized by platelets and cause platelet activation and aggregation. Does not cause erythrocyte aggregation or Rolex formation. Erythrocyte aggregation is not there or Rolex formation is not there because of this. Thromboxane A2. It is the product of cyclooxygenase pathway such by platelets and cause platelet activation and aggregation. If you learn chapter of platelets, you will get to know this. So it's associated with circulating pro-inflammatory cytokines, IL-1, 6 tumor necrosis factor alpha and necrosis factor alpha. It stimulates the liver to produce acute phase reactant proteins. Acute phase reactants is CRP protein, fibrinogen. The presence of acute phase reactant increases the erythrocyte sedimentation rate or a non-specific marker for inflammation. So, what we have learned from this question? There is low shows thickening of distal colon and rectum. It means there is a, if rectum is involved, it is ulcerative colitis. Ulcerative colitis. Ulcerative colitis, there is inflammatory condition. Inflammatory condition means increase in these things: interleukins, cytokines 1, 6, TNF alpha. These things will be increased. Interleukin 6 mainly stimulates acute phase reactants, because of which there is what? There is stack formation. Stack and settle to the bottom. ESR is raised. Okay. ESR is raised means acute phase reactants is raised. So interleukin 6, which is the pro-inflammatory cytokine. Done with this question. A 36-year-old woman comes to the office after she notices lump under her arm while getting dressed. Her arm is having lump. Says she feels fine and has no other symptom. Significant for medical history, hypothyroidism, family history negative. Physical examination body mass index 24. Breast examination shows non-tender left axial lymphadenopathy. Sent for ultrasound guided biopsy of the tissue specimen shows clumps of cells that are positive immunohistochemical staining for cytokeratin. Positive immunohistochemical staining. These cells most likely to belong which of the following lineages? It is epithelial, lymphoid, mesenchymal, myeloid, or non-endocrine. So, what is the lineage? It is epithelial lineage or lymphoid, mesenchymal, myeloid, endocrine. Now, tell me what is the answer? It is epithelial lineage. Why? Cytokeratins are proteins that help form the keratin containing intermediate filament that make up cytoskeleton for almost all epithelial cells. Keratin containing intermediate filaments. Keratin proteins highly abundant in exposed stratified squamous, such as epidermis or oral mucosa, and are less abundant but still present in simple epithelium such as liver, gut, and pancreas. Cytokeratin is commonly used immunohistochemical marker for epithelial derived tumors such as breast cancers. Keratin is also the major protein component of hair and nails. Keratin is composed of large amounts of alanine and glycine. So, keratin contains alanine and glycine. If you want your hair to be good, take a lot of alanine and glycine. Alanine, it's present in rice because of this small structure, able to coil tightly and form large numbers of hydrogen bonds. Keratin contains significant amount of sulfur containing amino acids such as cysteine. Formation of disulfide bonds between cysteine residues gives additional rigidity and toughness to the protein. This is the structure of the keratin. This is biochemistry point of view. So if you see keratin contains alanine and glycine because of which large number of hydrogen bonds are formed, and sulfur containing amino acid cysteine also there, which helps in formation of disulfide bonds. Now it gives additional rigidity and toughness to the protein keratin. So talking about the choices, so CD20 is a marker. It is used to identify B lymphocytes. So if there is CD20 to CD20 marker, it is B lymphocyte. FC and CD3 is used to identify T lymphocytes. So T for 3 and B for 20. 3 for T, B is second alphabet, and 0, 20, CD20. Vimentin is an intermediate filament present mesenchymal tissue and can be used to detect sarcomas. If vimentin is present, then it is sarcoma, which is derived from mesenchymal tissue. If myeloperoxidase is there, it is a peroxidase enzyme that can be used for the marker for myeloid cells, such as acute myeloid leukemia. If myeloperoxidase is positive, it means it's a peroxidase enzyme that can be used for the marker of myeloid cell, that is acute myeloid leukemia, AML. For AML. Chromogranin A and synaptophysin are markers used for neuroendocrine tumors. Chromogranin A and synaptophysin. Cytokeratic, commonly used immunohistochemical marker of epithelial cell sarcomas. Epithelial cell sarcomas. The next question. The cell identified by the special immunohistochemical stain shown to overexpress 185 kD glycoprotein that spans the cell membrane has tyrosine kinase activity in intracellular domain. Following is the most likely function of this protein. So here what it is saying, the cell identified by special immunohistochemical stain shown to overexpress 185 kD glycoprotein that spans the cell membrane and has tyrosine kinase activity in intracellular domain. Accelerated cell proliferation acts as a sex hormone receptor. Intracellular binding induces cytokine release and mediates endocytosis. 185 kD overexpression is the glycoprotein that spans the cell has tyrosine kinase activity in the intracellular domain. Hmm. You already know that HER2 oncogene codes for a human abdominal growth factor receptor with tyrosine kinase activity in the intracellular domain to play a role in activation of transduction pathway that control epithelial growth and diffusion. Epithelial sarcomas overexpress HER2 demonstrate increased proliferation resistance to apoptosis. Positive breast cancers have a high risk of disease recurrence and worse prognosis compared to two negative breast cancers. Trastuzumab, a monoclonal antibody against HER2, used to treat women who test positive for overexpression because here the prognosis is worse. So trastuzumab is the monoclonal antibody given. Estrogen, progesterone, receptors, intracellular receptors are frequently overexpressed in patients with breast cancer. Of these hormone receptor increases cellular proliferation, and patients with hormone receptor positive anti-estrogen medications to suppress tumor growth. What are this? In the previous we have seen there are two aromatase inhibitors. aromatase inhibitors. There is tamoxifen. Estrogen receptor anti-estrogen medications. Okay. So now from now pause the screen and watch my answer. Okay. My speaking capacity is gone, I think. Not able to speak much because I feel I'm tired.